Hi, my name is Najwa and I'm a pharmacy student from UBD. In this video, I will talk about protection from the sun, particularly with sunscreen. First of all, how does the sun damage our skin? Sunlight contains ultraviolet, aka UV rays. There are two types proven to be harmful to the skin, which are UVA and UVB. UVA has longer wavelength and goes deeper into the skin compared to UVB. Although they have different wavelengths, they both cause extreme damage to the skin. Sun-induced skin damage includes conditions such as sunburn, a condition where the skin becomes red, painful, and hot to the touch. Other signs include swelling, blisters, and even headache and fever if severe. More than one-third of adults and nearly 70% of children have gotten sunburn within a year. Photoaging, which is premature aging resulting in dry, rough skin, deep wrinkles, freckles, and dark spots on your skin. Actinic keratosis, where rough, scaly patches are found on sun-damaged skin. These patches may be whitish, pink, or brown. These patches can also lead to skin cancer. And lastly, skin cancer. Skin cancer is one of the most common types of cancer, which affects millions worldwide. How do we prevent these conditions from occurring? We can be more aware of photosensitizing medicines, including some antibiotics. Don't be afraid to ask the pharmacist about the side effects of any medications you take. If they increase your sensitivity to sunlight, you can take extra precautions to stay out of the sun in order to protect your skin. One of the ways to protect your skin is by using sunscreen and other sun protection gears. This will be discussed later on in the video. You can also check your skin regularly and see the doctor if there are any skin changes like new skin growths. The next part in this video is all about sunscreen. I will touch on the who, what, how, and whens of sunscreen. There will also be a short quiz for you to answer later. Who should be using sunscreen? Generally, everyone over the age of 6 months old should be using sunscreen. Babies under 6 months have very sensitive skin, so it's better to limit their sun exposure instead. What type of sunscreen should we use? It is recommended to use a broad spectrum sunscreen with an SPF of at least 30. Broad spectrum sunscreen means that it will protect the skin against both UVA and UVB. SPF, on the other hand, stands for sun protection factor. The number tells you how long UVB would take to redden your skin. In this case, with SPF 30, it would take you 30 times longer to burn than if you used no sunscreen. These three sunscreens are of different types, and all can be found in local Guardian stores. The first product on the left is a lotion, second is a watery gel, and third is a spray. Lotions are often preferred as they are thinner and thus easier to apply on large areas. Gels work best for hairy areas. Sprays are sometimes preferred by parents since they are easy to apply on children. However, sprays should not be applied near heat or open flames, and they should not be inhaled, so don't spray near the face or mouth. If you notice, on all three packagings, it is written PA followed by several plus signs. So PA means protection grade of UVA rays. It is a measure of UVA protection where the higher the number of the plus signs, the better the UVA protection. How much sunscreen should we be applying? In terms of measuring spoons, 2 to 3 tablespoons of sunscreen should be used all over the body and a quarter teaspoon applied on the face. For comparison purposes, a quarter teaspoon is more or less the size of a 20-cent coin. If you are using a spray sunscreen, this will not be applicable to you. You should be applying a spray sunscreen until a sheen appears on your skin. This will take a longer time compared to the other types of sunscreen. When should one apply sunscreen? We should be using sunscreen every single day, 15 to 20 minutes before exposing ourselves to the sun. Reapply every 2 hours of exposure and immediately after it is washed or wiped off. A common misconception is to not use sunscreen when it's not sunny. The truth is, even when it's cloudy, UV rays can still pass through clouds. UVA can also pass through glass, so it's important to use your sunscreen even when you're indoors. Since we would need to reapply, it is easier to bring a bottle of your sunscreen with you so you can use it when needed. You can store it at room temperature and make sure to not leave it in the car. To emphasize a few points, I will give 3 simple questions for you to answer. In which weather should the man use sunscreen? When it's sunny, rainy, cloudy, or partly sunny? The answer is all of the above. As explained earlier, UV rays pass through clouds. So even though the sky is looking dull, UVA and UVB can still harm your skin. A woman is working from home the whole day. Should she be using sunscreen? So the answer is yes. We should use sunscreen indoors unless in a dark room with no windows. This is because windows block most of UVB, but it doesn't block UVA. Last question. Should you use sunscreen only once throughout the day? The answer is no. Ideally, you should be reapplying your sunscreen every 2 hours and even more frequent if you sweat or if it's washed or wiped off. Before I end this video, I would like to say that it is important to use sunscreen daily and regularly. There are also a few other things you could do as well. The first one is to avoid direct sunlight when possible. In addition to protection of your face, do protect your lips by using a lip balm or other lip products with SPF. Dress to protect yourself from the sun. Use hats, sunglasses, long-sleeved shirts, and pants. That's all from me. Thanks for watching.